What is the best yeast infection treatment? Yeast infections are unfortunately easy to get. Women may note them if they have white discharge from the vagina, and vaginal itching that doesn't seem to resolve. Itching may feel like it is inside the vagina, and it may also itch on the exterior tissue of the vagina. Some women note a burning sensation when they urinate. Fortunately, yeast infection treatment is easy to obtain, and there are many over-the-counter medications that will treat the majority of these infections, approximately 90%. There are still some important guidelines to follow when treating a yeast infection. These include rules about when to contact a doctor and when to make the decision to self-treat. If a woman has never had a yeast infection before, it's important to confirm diagnosis with a doctor prior to using any form of yeast infection treatment. Some conditions may be similar in symptoms to fungal infections, and these can include several sexually transmitted diseases. Confirmation of the infection is thus valuable, as is seeing a doctor if any yeast infection treatment doesn't resolve the condition within a week or two. Some women are prone to getting these frequently and may need stronger medicines or prescription treatments to help eliminate the issue. When women are reasonably sure the condition is a yeast infection and not something else, the best yeast infection treatment is generally using an over-the-counter yeast infection medicine. These are antifungal medications and usually are one of the following medications: miconazole, clotrimazole, ticonazole, or butaconazole. For appropriate yeast infection treatment, these medications must be used exactly as prescribed. When medication packaging recommends a certain length of use, this should be followed to the letter, and not just stopped when itching ends. There are many of these medications that may only require a single application and may come in vaginal suppository form, but others will need to be used for a few weeks. When the infection is still present after use, it is time to see a doctor. A physician might recommend switching from one yeast infection treatment med to another or may suggest a longer period of use. Sometimes creams or suppositories don't take care of recurrent yeast infections. In this case, the best yeast infection treatment may be to take oral antifungal medication. This treatment may be recommended when the infection persists after topical antifungal medications have been tried. Many doctors may recommend using an anti-itch cream with low-dose antifungal meds, with oral medication, to address vaginal itching, especially on the vagina's exterior. There are some people who swear by using other methods to cure infections. Some women eat yogurt regularly as this may slightly increase natural yeast-fighting agents. Others douche with yogurt or with vinegar solutions. Visit the website. Click below.